This next story is about a family from Hanover, a small town south of Owen Sound. When the family set up camp at McGregor Point Provincial Park last summer, they certainly didn't expect a flash storm, nor did they expect to find themselves needing emergency transportation to Children's. They were hardly even familiar with this acute care regional pediatric center some 200 kilometers away. It's a story this family will never forget. A dramatic story recounted in detail in this mother's personal journal.
It was just black and wet, pouring rain. The crash, some nights still, just the, I can't describe it, like I wouldn't be able to duplicate the sound. It was just so quick. Rain. And Alanna, I didn't think she was gonna make it. Her brown eyes, they were eerie, but huge brown eyes, just get this thing off me. I wasn't ready to lose her at 10, going on 11. No. We hadn't lived yet. It was Tuesday, July 13th. We were camping at McGregor Point Provincial Park on Lake Huron. It was around 11 o'clock when we all tried to get settled in the tent for the night. Emma, our 2-year-old, was whiny and overtired. Alanna and Kayla couldn't quite get comfortable. Then we heard a weird noise, and my husband questioned if it was rain. It didn't sound like the usual sound of drops hitting canvas. Tom sat up to look out one of the tent flaps. Then we heard a weird rolling noise, and the tent sides rocked. Then the worst cracking, crashing sound happened. No one knew what was going on.
It was pitch black inside the family's tent. As Karen and her husband Tom tried to find their glasses, they realized that the tent roof had collapsed. They tried to push it up, but couldn't. They then realized that their daughter Alanna was pinned under a huge tree trunk.
And there was blood on her teeth. Her color was turning gray fast. She asked if she was dying. She said she couldn't breathe, and she couldn't continue. A lot happened. Help finally came. We were rushed to the hospital in Southampton. Alanna had a lot of injuries. They stabilized her, and then she, myself, the doctor, nurse, and paramedics all headed to London by ambulance. Kayla, meanwhile, had been sitting in another room. We figured she just had a broken arm, but Tom noticed a bump on her head getting larger. She was rushed to Home Sound for a CT scan, which showed a hairline fracture and a blood clot. Now Kayla, too, was headed to London.
Kayla was airlifted to Children's, the region's pediatric referral center. Her life depended on the transportation team ready to spring into action in an emergency situation like this. With a hairline skull fracture and a risk of bleeding, there was no time to lose.
Okay.
Meanwhile, Alanna and her mom arrived at Children's Emergency at 4:50 a.m. that morning. This is one of the largest children's emergency departments in the country, with more than 40,000 visits every year. A team of trauma specialists was assembled and waiting for their young patient to arrive.
We took her, again with a cast of doctors and nurses, to the radiology suite where she had an emergency scan that told us that she did have significant injury. It showed us blood in her abdomen, fluid in her abdomen, broken bones, and leakage of dye from her bladder. So we knew she had holes in a lot of things in there, sustained. There are lots of ways kids can injure their abdomen, but she was showing evidence of injuries in multiple areas, all of which were very serious. So this was now just very early in the morning. So we called up to the operating room and said, we're coming. It's not a matter of them telling us when they're ready. We go there and they take us, because she was a high-grade emergency. We had to get her before she became unstable from blood loss.
They told me she could die in there. She could bleed to death. I'll never forget hearing that.
No parent is ready for this kind of news, but the healthcare team at Children's is skilled in working with families, understanding their needs as well as their children's needs.
When you're dealing with parents, that has to be one of the hardest things to say to them. If you think that you might lose the child, it is very hard to say that. You want to tell them it's going to be okay, but they know as soon as they look at you, if you're not honest with them. Children know that too, if you keep things from them. And if you do it once, they'll never trust you again.
When we return, we'll find out how Alanna fared in surgery and how she recovers under the watchful eye of the specialists in pediatric critical care.
And joining us now is Dr. Leslie Scott, a pediatric general surgeon. Thank you so much for coming in today.
You're welcome.
You're very close to the Harringtons, to Kayla and Alanna, and what a story that Alanna in particular went through. 7 puncture wounds in her bladder. That was something you had never seen before.
That's right. It was an extensive crush injury that she had from the tree, and usually that can show up as a tear in the bladder, but in her case it was so severe we actually found 7 holes in her bladder that needed to be repaired.
And along with a multitude of other injuries.
Yes, yes.
So what is your first thought when all this is going on? How do you keep your focus at that point with very anxious parents and a very, very sick child?
I think that the focus comes because the situation is very serious, and that just happens naturally. So the attention gets focused where it's needed. The child comes first. Looking after the resuscitation of the child comes first, and as soon as we're able, we go to talk to the parents. But sometimes that can be a period of time, and as a parent, you're very cognizant that that is a very difficult time for the parent. They're the ones who love the child the most, and they don't know what's happening. At that point, it's quite something that I know more about their child than they do. And so when I have a moment to spend with them, I want to tell them as much as I can, even though the time might be limited. And I want them to know that I understand how critical it is for them.
We heard Alanna's mother say there that you told her she could bleed to death. Alanna could bleed to death. How is that going, telling a parent that?
Very difficult. First of all, fortunately, that situation doesn't happen very often. But when it does happen, for that moment that you're telling the parent that things are so critical, you feel it as a parent as well as a surgeon. And then that has to end, and you have to be the surgeon again.
Right.
Until the operation's over.
All right, well, we'll touch base with you a little bit later as we hear more of both Kayla and Alanna's story. Please call now.
A freak camping accident, something no one would expect. Thankfully, Children's was there, ready to respond, ready for trauma, ready for Kayla to arrive by air ambulance from Owen Sound, ready to perform life-saving surgery on Alanna.
Surgery was nearly 3 hours. Alanna had 5 puncture wounds repaired on her bladder. 25 centimeters of bowel was removed. Her pelvis was broken, her hip disconnected, a fractured femur and a fallopian tube was disconnected. Longest wait in my life.
Dr. Leslie Scott led the team treating Alanna for a multitude of internal injuries.
We opened her abdomen and had a look at what was going on there. And she basically did have a lot of blood in there and had ruptured through her bowel and torn the blood supply to a large segment of it with holes in it. As well, somehow she managed to injure her bladder in a way that she had 7 holes in her bladder, which I don't think any of us had ever seen before in a child. Indication of very significant compression injury across her abdomen. We were able in her to resect the bowel that was injured, and we were able to repair the bladder, but she had a very long incision and was taken back to intensive care unit on a ventilator. with Alanna, the impressive thing about her was her fight. And even though she had all these serious injuries, she was fight. She was giving us a hard time. She was complaining about the way things were done. And to me, that's an excellent sign. Excellent sign that her body is coping well.
Finally, they were both in pediatric critical care unit, both intubated. I don't remember a lot about that first day.
As Alanna recovered from hours of surgery to repair a multitude of internal injuries, she received one-on-one care, the highest level of patient care available. She would spend the next 24 days at Children's. Her sister Kayla was admitted as well, monitored daily for possible brain injury.
And when the brain swells, it only has a limited area for which it can go, at which time it will push downwards, and that's usually a lethal event. Our goal is to determine the mechanisms at a molecular level on individual cells that cause brain swelling, and if we can inhibit those mechanisms with drugs that we can administer to patients directly in the pediatric intensive care unit or even earlier in the emerge department.
Luckily for Kayla, the bleed on her brain stopped without intervention. She was carefully monitored for 2 weeks and then released from hospital. Alanna spent 3.5 weeks at Children's with follow-up care by her surgeon and many others on her healthcare team.
Being a surgeon is very rewarding for the simple fact that although things can be stressful, you can make a difference to people. The differences that last a lifetime sometimes. When you translate that, though, to children, it is very gratifying. There are times that are perhaps harder and more stressful when things are not going well with children than there are with adults. But to see children come through things amazingly well, they give back to you in an amazing way.
These kinds of specialists giving this kind of care are found right here at Children's. They are here when you need them. They were here for the Harringtons, and they are here for you, for your children. When we come back, the Harrington family is in for a big surprise, and they also work on a surprise of their own for Children's Hospital. Alanna and Kayla Harrington spent the remainder of their summer recovering at home. Early in the fall, they received the news that they had been selected as Forrester's Champion Children. The Champion program is run by Children's Miracle Network, a network of hospitals that Children's belongs to. As champs, Kayla and Alanna would travel to Ottawa to meet the Prime Minister and then to Orlando, Florida. All the time telling their story of their stay at Children's.
Seeing them there, I mean, they are champions. Like, Alanna especially was a lot better patient than I would have been. What she had to go through, it wasn't necessarily because of the surgery she had, but her other injuries as well. All the bruising she had, like in Southampton, you could see the bruising on her back big time already. She was all kinds of blues, blacks, purples, and then big, huge yellow puffing bruise on her. Like, she was a mess in Southampton already. And so anytime they had to move her, she was in so much pain. And she had to get frequent x-rays to make sure her hip was still in place for the healing. And that hard table, like, she had to endure so much. And then Kayla not knowing what was going on, because at one point we really didn't know, because it depended on the bleed, what would happen. And then Kayla had to watch Alanna go through a lot too.
These champion children are now back at school, playing together with their friends as all kids should.
Expertise was there, the experience. It was a place to be if you had to be, really. Unless you're in that situation, you don't know what the family goes through. It's not just the kids or whoever's injured, it's the whole family unit that goes through so much.